Reading this comment, I got lost down a rabbit hole and I had to figure out exactly the origin of the term left shift. I agree, it is not because the immature cells are on the left side of a manual counter, but I don't think it's because of the scatter plot. Here's an example of a normal visual representation of the differential as a scatter plot or scattergram. Took it from this paper for your reference. I don't know exactly when the first hematology analyzer came out, but this paper is the earliest thing I could find evaluating the Coulter Model S, which is a hematology analyzer. So let's assume that hematology analyzers performing scatter plots happened sometime around in the 1960s. Pulled out this book, which was published in 1932, Clinical Interpretation of Blood Examinations. And in the section on leukocytes, they describe the Arneth count. I have a different video where I reference Dr. Arneth and his way of dividing neutrophils. And so this describes this here. I can't find the original source on this. Apparently it's in German from 1904. So it looks like this term left shift may have originated in 1904. If there is a shift towards this side or an increased index, that is a shift to the left, and a decreased index, a shift to the right. Now this book also mentions Schilling's hemogram, and I'm going to show some articles where they talk about the Arneth-Schilling hemogram. I mentioned in another video Dr. Damashek, and here this is a publication on progress in hematology that he published, reflecting on progress in hematology in 1934-1935. I pulled this from the New England Journal Archive. And Dr. Damashek references so-called Arneth-Schilling counts, the shift to the left that they describe. So the Schilling differential count is mentioned in this paper. Here's what the original paper looks like. Here, they're saying that Schilling's so-called shift to the left is an increase in unsegmented neutrophils, which may be degenerative. This is a normal Schilling hematogram. It includes not only neutrophils, but other cell types, and now is incorporating juvenile cells and myelocytes. I agree it has nothing to do with the manual counter. I don't think that the left shift term originates though because of these scatter plots, which I think entered heavy use in the 1960s and 70s with the introduction of the automated differential. It looks like this term dates back to about 1904, and we should credit Dr. Arneth with this. But this idea that left shift is not just about neutrophils seems to have been adopted later, incorporating the work of Dr. Schilling. Hope that helps. Follow for more information about blood.